Happy to have you with us today. We have a special guest, Dr. Phil Boucher, who I was joking that he needs no introduction, but truly he doesn't. Probably most of you already know him already, and that might even be the reason that you're here today. So we always love having you on, Dr. Boucher, so thanks for joining us.
Thanks for having me. I'm excited to be here.
Why don't we kick things off by you kind of giving an intro and let everybody know all of the hats that you wear?
So I'll go back a while and say that I've been a pediatrician for 10 years in the hometown that I grew up in. 2.5 years ago, and I don't say this just because it's a Freedom Healthworks webinar, but I was looking for a new podcast and I happened upon Healthcare Americana. And that kind of actually started my journey towards opening my own direct primary care practice. I always felt like, gosh, there has to be a different way rather than seeing patients every like 5 to 11 minutes. It just didn't work very well for my enjoyment of medicine or my family life or the way that my patients were being cared for, to just feel like, okay, I'm going into a room and there's 2 more rooms that already have people waiting. And so I'm going to have to be quick and I'm going to figure out how to really quickly navigate out of this visit so that I can keep seeing patients. And so eventually I was just like, I want to do something different. And direct primary care was what I found. And I started my pediatric direct primary care practice. We opened in 2022, like on January 3rd, 2022. And it's been fantastic. And it's been everything I hoped and dreamed for. We've grown from 0 patients to over 600 now in the past 2.5 years. And it's been really amazing way to take care of families, to take care of myself as a human being and pediatrician, and also as a way to take care of my employees and everybody that I got to care for.
Love that. I love that you plugged Healthcare Americano. That's a great resource that we hear that a lot from people, that even their introduction to direct care came from that. So
Yeah.
Chris Habig, our CEO, will love that little shout out.
Yeah. I mean, I wouldn't make it up, because I feel like it takes somebody to tell you and like for you to hear that that's an option and that's something that you could do.
Yeah. And one thing I love too is whenever I think about DPC and reducing burnout, you and your family pop into my head, because I love following you on social media. Shout out to your marketing efforts, which are amazing. Um, but you have a large family and you get lots of family time. And I love
Yeah.
that you post about that and show that. Can you fill everybody in a little bit on family life and what that looks
Yeah.
like, that balance?
So we have 6 kids. We started having kids when I was in medical school, and we have a 14-year-old down to a 3-year-old now. And then what DPC has allowed me to do is make sure that I can be home for dinner every night without having to sacrifice for patient availability or anything along those lines. When I was in my traditional practice, I would see, 20, 30 patients per day. You'd have to do all the charting in the evening. The practice of medicine in the fee-for-service model, you have to constantly be filling those patient spots and filling those patient spots and filling those patient spots, which means if somebody's kid is sick today, if they want an appointment, it's got to be in the evening, because there's no way that you can just squeeze them in during the day. And so it's going to be an evening appointment where they get seen, which means that somebody has to be there, not just the person seeing them, but the support staff and the front desk and all those other things. Now we're able to get all our patients seen, and my entire team is gone by 4:30, not because we're saying we can't see you or you have to go to urgent care or anything along those lines. It's because we can just say, yeah, well, why don't you come over? Or your child might need stitches. Why don't you just swing by and we'll take a quick look? Or your kid has a fever. It's Friday afternoon. I don't really want you to have to wait through the weekend. I also don't really want you to come in tomorrow morning. Why don't you just come over right now and we'll take a quick peek at the ears. We'll listen to the lungs. We'll make sure everything is okay. And it's so much easier to do that when you have long appointments. It's easier to find that bandwidth. And so that's a long way of saying that DPC has allowed me to be present as a parent the way that I want to be, and also to care for families in a way that feels really good and helps them to thrive as well.
I love that because you're really practicing what you're preaching too. So you're telling these families, for those of you who don't stalk Dr. Boucher on
Mhm.
Instagram, you're telling all these families healthy ways to deal with conflict and stress. It's not just
Right,
um, physical health, but you also talk a lot
right,
about mental health. And I love the
right.
way that you then are applying that yourself and aren't just, shelling out easy answers. So
Yeah.
that's awesome. What about when you first started? Did you have a hard time shedding that go, go, go and the no boundaries, or was it pretty natural for you?
I think it's been natural for me. Like in terms of the go, 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 I think parents are busy. And so we want to have like a productive visit together, which usually means like patients are able to get in easily. They don't have to wait a long time. We're able to connect and chat and see the child, get the things that we need to done, and still have pretty relatively short visits in terms of like we connected, we chatted, found out what's going on, and then we're able to move on with our day. I don't know if I've completely separated from the go, go, go of like get patients seen and move on, but I think it allows me to respond to patients the way that they need. Sometimes they're just in a hurry. Sometimes literally all they want is their measurements and their vaccines, and this is their third kid, this is their fourth kid. Like they know what to do. They don't need me to explain to
Yeah.
them, how to start solid foods or, what to do for potty training or things along those lines. And so I just read the room and I'm like, okay, it seems like you have what you need.
Mhm.
Do you guys have any vacations planned? And then sometimes it's sitting down and connecting in different ways. Today I had a patient came in that I've seen for years and years, and she's in a wheelchair. And the mom really wanted me to show me a video of her at this dance that she was performing in, and I was just able to like there was no
Oh, I
rush.
love that.
Yeah, it was beautiful. I just got to sit there and watch that and experience
Yeah.
that and talk through all that with them. And so it opens up a lot of different opportunities where you just don't feel that constant tug and push
Mm.
to get to the next patient room and get this patient seen
Yeah.
and treated. You just are able to do what patients need depending on the varied circumstances of their lives.
I love that. I think that's a good segue to my next question for you about relationships. I mean, I think
Yeah,
direct care is really, of course, it's about the freedom and all of the great life balance that it brings, but there's so much about connecting and relationship building, and I think you do
mhm.
such an excellent job with that. I love, you've done lots of different things to put in place boundaries with your business,
Yeah,
and also most of those are to make it so that you have the time to connect with them deeper on a deeper level. And it's just being a parent on the receiving end of direct care in pediatrics, it's such a relief to walk in somewhere where someone will listen to you and you don't think
right,
you're crazy. And not
right,
only that, that you can just be yourself. Before we were in DPC with pediatrics, I like would make extra time to get myself ready, and I wanted to be like in my best shape. And I thought
right,
like I've got to have all these things put together, which anybody who's watching that knows me is probably giggling because I'm very much just a go and not prep kind of person. And
right.
now with our DPC, we can just let our hair down. I want them to see the crazy because I need their help. They're part of our team of
Totally.
raising kids. And especially that mental health piece now, especially in pediatrics too. I mean, it's always been important, but um, we could go on a rant about that for a while, but
Yeah,
I think that's kind of something that I found really interesting too. The more I've learned about the systems that you have in place, you make it so that you connect, but you also have boundaries. Can you
yeah,
talk a little bit about the system that you use to talk to your patients that
yeah.
keeps from Instagram and Facebook and Messenger and all those things so you have everything in one spot?
So a couple different things. One is on the like I think a big question that people have when they're thinking about direct primary care
Mhm.
is how do you maintain boundaries? Because you're kind of sold, like patients are sold easy access to your doctor or text messaging or all of those sorts of things. And so I think from that perspective, making sure that the expectations that you set with your patients are very crystal clear. Like, here's when we're available. If you want to talk to me at 2 in the morning, I can't be available to chat about your parenting needs at 2 a.m. or those sorts of things, because I need to sleep so that I can be present for my patients and my family and to be rested and all those sorts of things. So it's important that you just set those expectations when you're starting and reinforce those as you go along with your patients, and they will play ball if they understand what those are. I think that's a common fear, is my patients are just going to expect to have carte blanche access to me, whether I'm out to dinner with friends or whether it's the middle of the night or whatever it might be. And I always try and help physicians that are thinking of starting in direct primary care. Like, we have a pool that we belong to. You get access to the pool by paying for it, but there's still rules. Like, you can't run at the pool, and I can't go to the pool at 2 a.m. and expect to get in. And there's a big board that says, like, here's the rules at the pool. You can't have alcohol in the pool, no glass bottles, all of those sorts of things. If the rules are there and clear, then I'm going to abide by those rules. If they're not, and it's just like, here's your all access swim pass. Well, it says all access on here, and I want to go swimming at 2 a.m. I'm going to want to go swimming at 2 a.m. Like, I'm going to expect that. But if I read the rule, like, oh, here's the open hours and here's the rules of the no running and all those sorts of things, then it's like, okay, those make sense. So if you explain on a regular basis and then enforce those boundaries, patients will understand and they will be very comfortable with those boundaries. The way it works in our practice, just to get in a little bit more into the weeds, is during the day, most people just text us, honestly, because it's the easiest, and we have a pediatric practice full of millennial and Gen Z parents, and they want to text. They don't want to call and talk on the phone. And so most people text us if they need something. If they want to book an appointment, they just go on our website and book the appointment so that they don't have to text or talk to anybody. They can just pick their own appointment time. If it's the evening, they'll typically text, and I kind of do keep an eye. I don't have the expectation that, like, until a certain time I'm available, but I keep an eye. The text messages come in, they're super easy to read. And it says, my kid has a fever, what's our ibuprofen dose? I can be like, well, here's our ibuprofen dose, or, let's see in the morning, or those sorts of things. Overnight, they can text, and I tell them when they sign up or when they're joining or talking about it, as we're talking through what to do with your child. If you have concerns overnight, I tell them it's fine to text at 2 a.m, because a lot of people are up feeding their baby or something like that at 2 a.m, and they think of some random question that is just a fleeting thing that if they don't ask it, they'll forget about it, and then it'll linger and they'll think of it again. I tell them I'm not going to respond at 2 a.m to your text messages. If you have something that you can't wait till the morning, we have a nurse triage line available, so they can call and talk to a live pediatric nurse at 2 a.m to talk through what's going on. If it's something where they're deciding, do I need to go to the ER? What do I need to do for this? And so that's how we set those boundaries and expectations. And honestly, 2.5 years in, I've never talked on the phone to anybody after 10 o'clock at night,
Wow.
any patients or anything along those lines. The nice thing too, kind of relating back to what we said earlier, is that when there isn't this like queue of patients constantly waiting and needing things they're waiting on you, you're able to get things done during the daylight and get those things wrapped up and kids tucked in before they get deep into the evening. It's not like nobody was able to talk to them. Nobody got their questions answered. It's 8 p.m. I'm looking for information. No, we just take care of those things as they come up throughout the day. Because most kids that are sick throughout the day, and so that the parents can just text and get help at those points. Now, when it comes to the marketing side of things, there are a lot of different channels where patients will reach out to us when they're thinking about joining. And so we use some software that just helps to kind of get it all in one place. So if they're on our website filling out the contact us form, if they're emailing us, if they're text messaging us to learn more about the practice, it all kind of, or if they're sending us a message on Instagram or something along those lines, it all goes into one place, like a unified inbox, so that we don't miss those. Because when they're not our patients and they're kind of learning about us, they'll find whatever sort of way they want to contact us, and we want to be receptive to that without making it hard for them to feel like they're getting through to us and we're responding back on the channel that they prefer to talk on.
I like that you just meet them where they are. I think, I kind of joke that we have this line of, if you're on Facebook, you're 45 and up, and you're on Instagram if you're
Yeah.
below, and you don't have, just like you said, they want to connect where they connect, and you want to get all of that.
Right.
But so it's helpful for them because you're responsive. But I look at that more on the reduction of burnout side, right? Like anyone who gets into direct care, I shouldn't say anyone. Almost everyone I've ever met who gets into direct care does it because they have a huge heart and they want to be there
Right.
for their people, right?
Right.
And so it allows you to not go overboard and have those boundaries for yourself too. So you're not having in your head to have all these tabs open of, oh, I got to make sure I check my Facebook. I got to make sure I
Totally.
check. I've got to make sure I check my, elation, whatever however you're communicating with your patients. I love that it keeps that in one place. And
Yeah.
a little shameless plug for that software that he's referring to is part of our base bundle for our GPO through Freedom. So you can get discounts on that as well. So if you're interested in learning more about that, feel free to reach out to either of us, actually, would be able to
Yeah.
help you with that. There's something else I wanted to ask you about that on the boundary side. I think Dr. Cook and I touched on this last week on her webinar, if you were able to attend that, about how when you're getting in at the beginning, you get excited and you feel like, oh, I'm going to be here, I'm going to be here. But you
Right.
have to remember that those people that are coming in then are going to expect that level of service even when you're full. And
Right.
that's a good way to end up burning a bridge. I like how you framed that, setting the expectations with those families too.
Yeah, I think if you set the expectations super high, like if it's like, oh, your child has croup, I'll just come over to your house and give you some steroid at 7 o'clock or 8 o'clock at night so that everybody gets a good night's rest. Beautiful, amazing sort of thing to do to help a family, and they're going to be patients for a while if you do that sort of thing. But it's really hard to scale that, and it's
Mm-hmm.
really hard to scale back their expectations when you set them that high. And so we try and just set reasonable expectations that are already over delivering compared to what parents are used to when it comes to their pediatric care. And that allows us to do a better job without overextending ourselves, over promising. We promise and then we deliver, and we try and over deliver as often as we can. There was a mom that just called because her child had fallen in the parking lot, and she wasn't sure what to do, and she was just kind of appropriately frazzled and upset about it and not sure what to do. And at at a typical practice, that would be talk to the nurse. Oh, you got to come in. We got to check him out. And my receptionist was just like, well, let me just patch you through to Dr. B. I know he's in his office. He can talk to you about it. This mom did not need to come in for a visit. She didn't need to have an assessment done. The child was totally fine. She was just overwhelmed because of having witnessed it and just needed to talk it through for a couple minutes. And that was all that we did. And I said, here's what to watch for, and let us know if anything comes up. In the past, that would be layers and layers of, oh, let me take a note. Let me send you to voicemail. Let me do those sorts of things. And it was just because it's so easy to connect with families, it really does allow you to set reasonable expectations and make reasonable promises and then deliver and over deliver on those.
Yeah, I think that's a great way to set it. So can you talk us through kind of what that first visit looks like in your practice of how, as far as the boundary setting goes, and
Yeah.
for you have some nurse practitioners as part of your staff, and then are you the only physician, or are there other physicians there as well?
I'm the only physician, and then we have a nurse practitioner that's part-time, and then a full-time PA
Okay.
on our team. And so what it looks like, honestly, at the first visit, like when they've actually joined and everything like that, we've the parents are by that point already know what the expectations are. So there's not a lot of like rule telling then. I feel like that, like I don't want people to join and then be like, here's all the rules. Like you
Mm-hmm.
join the pool, but I have to tell you, you can't come at 2 a.m. I want them to know that before that they join, so that they know like the pool is not available to you at 2 a.m. And so what that looks like is when they come in for their meet and greet, I kind of lay out for them exactly how our practice works. And the main thing that people want to know is how to communicate with the practice, especially if it's
Yeah.
communication in the evenings or overnights. What does that look like? You tell me that we can text, but what are the specifics of how that works? And so that's where I give the example of if it's 2 a.m. and you have a random potty training question and you're up feeding your baby and you just want to text so you don't forget, just text us. I'll see it when I get up in the morning. We'll respond when we open, those sorts of things. If it's something that's more serious, if you need to know if you need to go to the ER, that's when you call and we get you taken care of. And then once they join, we have an onboarding email sequence that every day sends them an email that helps them to have all of the information that they need, whether it be our hours that we're open, whether it be how to schedule an acute visit, like here's the link, save this in your phone so that when you need a sick visit, here's our phone number. text us so that you have it in and save it in your phone. Here's what to do if you need this, that, or the other thing. Here's when the typical appointments are. Here's the link to schedule those appointments. And here's the point of contact if you're not sure what to do, if you have a question about your bill, if you need a super bill. All of those things are laid out in an email sequence that they get in the first days that they join, so that there's no confusion and everybody has that information. And it's been, explained out to them in detail, and they can always refer back to it if they're not sure. People will, just get on their Gmail and look for our phone number or something like that. They can easily find those things because we've given them all the information in bite-sized bits that they can handle over the days once they join.
You're the king of the sequences of emails. And I know
I just like to
I've
automate. Like I think I've inspired my staff to try and automate literally every step of everything that we can, so that a uniform experience. There's no chance for the ball to be dropped because we just rely on the systems then, and we don't have to be trying to think all of those things up or remember, did I tell them something totally different? Why would I have told them that? But I don't have any documentation of that. At least we have like you saw the email sequence. I can actually see that you opened these emails, you read them. We should all be on the same page on these are the expectations and this is what we delivered and didn't deliver.
Yeah, I think that automation goes hand in hand with burnout prevention in DPC.
Oh, for
I
sure.
think when I first talk with someone when they're just starting their research of DPC, a lot of the times it's, okay, so what does this mean? And one of the first things I say is you take all that time you spend billing and coding and
Right.
it's gone, and everything's automated with that. Like that's one of the first pieces that we talk about.
Right.
So I think, I've been an attendee at some of your wonderful webinars. And so I've been on the receiving end of those. And people will kind of push back with an objection of, well, isn't that going to annoy them? Not when it's a topic you're interested in, like
Right.
your child
Right.
or
Right.
your own health. When you've made the decision to make, not in pediatrics, but in the big people world, to take care of your own health, those are
Yeah.
things that people are interested in, that they want that touch point about.
Totally.
Just pitching services all the time or trying to upsell them, that's different. But when you're providing the education, you're providing everything they need to really take advantage of the money that they're spending outside of their insurance for your practice,
Right.
it's typically.
It does help with touch points a lot, and it makes them feel more cared for and taken care of. And we use automation in lots of different ways. I mean, one thing that we'll do is, and this I would love, and I'm always trying to figure out how to completely automate things, but a child comes in for a sick visit and we send them a text message the next morning, how's little Jimmy doing today? That sort of thing.
Yeah.
That's a system that we have in place. It would be nice if it was totally automated. It's not, but we have a system in place of at the start of or at the conclusion of the morning and at the end of the day, we just go through and really quickly, do a little pre-click text message to those patients that came in for sick visits today, so that we know that at 7 o'clock in the morning, they're going to get a text message tomorrow checking in on how they're doing. And so that's somewhat automated. It would be nice if it could be totally automated. I don't have a perfect system for that yet. But we are but we are able to say this is automated because I know what's going to happen, because it's a system that we've set up in a standard operating procedure in our practice, so that those things don't fall through the cracks. And we pick 7 a.m. because I want to text them before they text us with an update. And so at 7 a.m. they get that text message. Parents are up at 7 a.m. so it's not a big deal. Checking in, and of course everyone likes to be checked in on. So even if that is waking up at 7, it's going to be a welcome. Oh, my doctor cares about me. They thought about me.
And that's such a difference from the traditional world, especially when it's their first visit. I think, the first time people really feel that is when they walk in the door. I'll get the comment a lot from on the patient side. Oh, I thought I was walking in the wrong door, or I thought I called the wrong phone number because the doctor opened the door, a doctor answered the phone. That kind of hits them first. And then after their first sick visit or whatever you're touching base on, that's not something they've ever experienced in healthcare before. If they do, it was because it was a very emergent, very like a crisis situation that would cause them to reach out, where someone would have the time to do that, I think. So thank you for sharing that. That's great.
Yeah.
We've got a couple of questions coming in here, and I know you and I are really good at talking for a very long time. We kind of nerd out about all the same things. So I'll grab these questions here for you. We've got some good ones. How do you prevent burnout in your own life? Not in the practice.
I think in my own life, preventing burnout, there's a couple of different things. I mean, one, it's like taking a pulse every now and then so that we're making sure, like, am I getting enough rest? Am I getting enough exercise? Am I getting enough time with my spouse? Am I getting enough time with my kids? Am I getting enough time for myself? And the answer to a lot of those is usually no. I could use more of all of those things. But what can I do to reduce the demands on me so that I have time for those things? I think time is one of the biggest issues around burnout. Is you just don't have time for the things that you really want to do, and what you need to do to fill your own buckets. And so once we make that time, then it gets a lot easier. And if we're saying, well, I just don't have time, well, maybe there's things that we need to cut out. Maybe it's things that we need to automate so that we have that. Maybe there's things where we can delegate it out to somebody else, even if it's a part-time assistant or a part-time staff member or something along those lines that we can delegate to and figure out how to reclaim that time. I think that most people, most physicians in particular, feel more burnout when they don't have the time to be present for the people that need them. And so if we can figure out how to reclaim that time, I've been on wellness committees at groups and practices and hospitals before, and a lot of it is trying to, make people more efficient or get them to do yoga over their lunch hour. But what people really need is they need to feel affirmed in their work, valued in their work, and then they need to have time to be able to focus on what really matters to them, which is
Yeah.
typically not like getting their charts done on time or meeting sort of RVU metrics or those sorts of things that are important to the hospital administrator. You know, those things don't help prevent burnout. They cause burnout. And so if we can instead focus on giving people their time back, then that, I think, is the surest way to help them to feel less burnt out. And then making sure that with that time reclaimed, they're able to fill up their bucket, they're able to take care of their mental health and their physical health and their emotional health and all those sorts of things. And I find that that is really what helps when it comes to burnout.
Yeah, I think that's spot on. One of my kind of pet peeves is hearing people say, I don't have time. Um,
Mm-hmm.
especially, with us being parents of many children.
Mm-hmm.
I often will hear that and just kind of cringe because typically it's from my 23-year-old single sister without children, but that's a whole other. But I think that, for me, what I've had to rephrase in my life when I was really working on burnout prevention myself, as I don't think I've mentioned this, but I'm also a nurse, is I'm not making the time. I don't want to make the
Mm-hmm.
time. Why is that? Is it something I need to make the time for?
Right.
Like we touched on last week, when you're saying yes to something, what are you saying no to? There's
Totally.
all these
It's a
little mantras.
prioritization thing. Yeah,
Yeah.
it's definitely priorities.
So, and then if even not even saying it out loud, but just thinking to yourself, like you said, when you're taking those pulses of why am I not making the time and why
Yeah.
am I choosing not to make the time for this? I think that's a big one, uh,
Mm-hmm.
that will help uncover, the root of those causes as well.
For sure.
And along those lines, someone asked, how do you protect your time off for vacations and holidays so you don't creep back into that burnout space?
For vacations, for holidays, for weekends, I think the thing that I continue to learn is that when I communicate, that things go better, and when I don't communicate, then things creep back in. So I am a little bit notorious for not always blocking my schedule out, which then leads to, which is a form of not communicating,
Mhm.
right? Because I didn't tell anybody that we're going on a family vacation, and I actually just need this time blocked out because my staff will certainly rise to the occasion if I let them know.
Mhm.
But if I don't, then it can be really hard when it's like, oh, we need to reschedule these patients because he didn't tell us he was going on vacation.
Mhm.
Uh, and then so then I feel bad, and then I let things creep back in, or I make exceptions, or those sorts of things. But if I can communicate in advance, we're going on vacation, I won't be available. Here's what you do, and if you communicate that to your patients, then there aren't surprises, and then they'll be asking, oh, how was your trip to Florida? How was your weekend? How was your anniversary trip? Whatever it might be, they're excited for you. They know that you're like a human being as well. And so if you communicate in advance, hey, I wanted to let you know that in a month, patients, I'm going to be out of town for a week. And here's what we need to do to prepare for that. If you need your prescriptions refilled, just let us know and we'll get those sent in. If your child is sick, here's what you're going to do. And here is what we'll do when you get back. And we just block that out on the schedule, and then you make it happen. Now, in direct primary care, you don't always have those other people that you can like rely upon. So it is a little bit of making sure and setting those expectations. So before I had my nurse practitioner and my PA, we were going to Florida for a week, and this was shortly after we opened. And it wasn't planned that way. It was planned when I was still not in the DPC world,
Mhm.
and we didn't want to cancel our plans and all those sorts of things. So I had a friend who's a pediatrician in town. I said, "Do you think you could just keep a little bit of an eye on my clinic? Meaning if
Mm.
somebody needs to have their ears checked, if they need to have a strep swab or something like that, can I pay you to just come over the lunch hour and see those patients? And then we'll keep going from there. And if they need anything, they can reach out. If there's anything that isn't clear, just call or text or whatever it might be." And that allowed me to leave town, have somebody that was kind of watching to make sure that sick patients weren't falling through the cracks,
Mhm.
and to be able to get away and know that things would be okay when I got back. It is helpful if you have those sort of resources where somebody can kind of watch the phones for you
Mhm.
and take care of those things. But I don't think it's unreasonable to say, hey, you patients get the immense benefit of this small practice and this close relationship and the ease of all these things that doesn't cost an arm and a leg, and
Mhm.
I'm going to be gone for this week. And if you're going to need something acutely, let's get it. Well, if you need something, chronically, let's get it out of the way ahead of time. But if
Mhm.
you need something acutely, I've talked with the urgent care, and they're going to be able to get you in and get you seen and all those sorts of things and communicate. So FYI, while I'm gone, here's who you call, here's where you go. That is an entirely reasonable approach to vacation for DPC doctors.
Yeah. I think, and there's no faster way to make a friend than asking another direct care doctor if you want to trade vacation coverage.
Totally.
Because
Yeah,
like
I see that
they
all
have
the
the
time is
same thing.
people trading vacation coverage so that they know that they can get out without having to worry so
Mhm.
much about all of the text messages and those sorts of things. I mean,
Right.
a lot of it can wait, but some of it can't, and you don't want people to feel out of the loop or anything along those lines. But as long as you communicate and say, "Hey, we're going to Disney World. We've been looking forward to this for 2 years. I know that it's going to be a hassle if your kid gets strep throat while I'm gone, but I've talked to the urgent care down the road. They will be able to get you in. They will get you seen. If they aren't sure what to do, they have my direct cell phone number, so they can call even if I'm at Epcot and get through. Not a big deal. And I'll be back and I'll share pictures with you and those sorts
Yeah.
of things. And then patients love that. They're not going to switch doctors
Yes.
because you're going to Disney World. And if they are,
They're not for
you
you.
probably don't want them to be your patients anyways. Yeah.
Exactly. I love that you said
Yeah.
that. I think
And that's
another
how you prevent burnout, because you can't go and say, well, I'm going to be available 24/7, 365
right.
for a few years until I get help and I get support, and then I can resume my life. You'll just be back in that burnout because you're not seeing 30 patients a day, but you're constantly
You're
tied and
on.
married to
Yeah.
this, and it's interfering with your life.
Yeah, you're on all the time. I think also back to kind of your email sequences. I think it's so fun then to have a picture email go out of you with your Mickey ears of
Totally.
thanks so much for respecting my time while we're on vacation with the family. What are you guys doing for vacation this year? And then you've
Yeah,
got a great
totally.
sequence. One of my friends is actually on this call who her direct care practice asked, like you mentioned at the beginning, what vacations are going on. And they provided her with this little baggie. It was international travel of like,
Yeah.
stomach things and band-aids and, all the little things that you need. And that just shows even more investment in their life and
Hmm.
development of that. Just personal relationships. So I think
For
there's a lot
sure.
of ways that you can keep that going and keep them engaged rather than feeling like, oh, my doctor abandoned me for
Right.
Epcot
Right.
to drink around the world.
Yeah,
um, okay, other question is, can you tell us a little more about the software you use for prospective patients? What's it called?
I sure
That's a
can.
big one.
It's called Practice Leads. And the website is getpracticeleads.com/DPC for like the DPC specific information about it. The way it works is essentially once they're your patients, then they're going to be in your system, whether you're using Elation, Hint, Atlas, whatever it might be. But before that, you have these prospective patients that you want to keep track of, that you want to be able to say, they were interested in this. They have not yet booked a meet and greet. What can we do to reach out to them? based on their interests to
Mhm.
make sure that we're moving them towards booking that meet and greet. And you can collect and keep all the information there, whether they email you, whether they, fill out a form on your website, whether they text message you, or whether they reach out to you on social media. It's kind of all in one place and kind of keeps a little dossier of the prospective patient so that you know about them and what they're looking for, and you can keep reaching out and keep in contact with them. The worst thing that happens a lot of time, especially in DPC, because you're wanting patients to come in, you're wanting to attract new patients, is, oh, I talked to somebody, or they filled out a contact us form. I can't even remember if I talked to them or where we're at in the conversation, or if they booked a meet and greet. They came in, they said they were going to join, but I can't remember if they actually ever did join. It's just hard to keep all of those disparate pieces together when you have all of the different things clinically, all the different things as a business owner, and you're trying to bring in new patients. And so Practice Leads just lets you collate and collect all of that into one place where you can say, this patient was interested in an ADHD evaluation. This patient is a newborn, and I can see that their baby is due in July. I should probably reach out and make sure that they get registered so that we have them on the list for July, or find out if they have any questions, or get them a little bit more information about what to expect with their new baby, all in one place, so that those balls don't get dropped because you're juggling so many different things. The way that we've used it lately, we did in a baby expo. So it's a local event that's put on by the purveyors of baby crap in our community. I mean, like all the different, baby stuff
Yeah.
sellers are there. So we have a table there, and we have a book. I don't think I have one here, but we give out copies of Baby 411, which is the book on new baby life and all the baby questions and all those sorts of things. They scan a QR code, they put in their information, we give them the book. And then
Mhm.
we're able to follow up with them, find out about their, when they're due, any questions that they have. We send them some social media posts of mine, and our practices about breastfeeding and about weight loss and about different baby related things. And then we move them along that journey of, hey, do you want to book a meet and greet? Do you want to come into our office and learn more about our practice and how it might help you with your new baby? And so all of that is streamlined and automated inside Practice Leads, so that we're able to have those touch points without having to keep remembering, or, oh, I think I saw somebody at the baby expo. They said they were due in the summer and I don't remember anything about them and I have no idea how to reach them. Giving them something in exchange for their information, so that then we can reach out on a regular basis, make sure that they're getting information and deciding if we're the right fit for them.
I think it's such a great idea, especially when, I mean, I can see how it can be helpful for anybody, but especially when you're first starting out and you're out there trying to meet
Right.
so many people, they all start blurring together, even if
Oh,
you're really great like with names. But I
for
think
sure.
that that's a great thing to do. So again, if you have more questions about that, please feel free to reach out to Dr. Boucher or myself. We'll have an email going out after this webinar is complete, and they'll have all the information you need there for how to get a hold of either of us.
Awesome.
Um, Last question. How quickly into opening your new practice did you see a reduction in your work exhaustion and burnout?
I mean, even before I opened, I feel like I was less burnt out and
Mhm.
exhausted because of the light at the end of the tunnel. It's
Mm.
easier to tolerate those 30 patient days when you know that in a few weeks or months, you're going to be seeing 10 or 12 patients per day at the
Yeah.
max. But immediately, like the charting documentation drops dramatically, not because just the patient volume is less in DPC, but also because you don't have to write these, 7-page long notes to satisfy all the insurance documentation requirements. You can focus on child has 2 days of fever, following 7 days of upper respiratory symptoms and is sleeping poorly. Left ear is bulging and erythematous. Will start antibiotics, and that's your note. I mean, it doesn't have to get a lot more complicated than that. It feels like the olden days where they would just scribble on the piece of paper and it'd say
Yeah.
left ear infection treated. And that would be the note. And essentially what we're doing is we're making sure from a liability standpoint that we're documenting, and then we're making sure that me in the future can remember what we did at that visit. And that's what the purpose of the documentation is. It's not to satisfy all these insurance requirements to get reimbursed in 3 to 6 months when they,
Right.
send in your payment. And so that helps dramatically. Just the time back, I think, is the biggest thing that direct primary care allows, is you
Yeah.
can reclaim all of that time, and you're able to focus then on that. I mean, there are flip sides, right? Like, you're a business owner. you have to keep up with all the different business related things. Um, and that can have its own struggles and challenges as well. But you have more time for that too. And so I think that helps when it comes to balancing the business owner hat and the clinician hat, that you're now wearing both of those, but you have more time for each.
Yeah. I love that you were helping out future Phil.
Exactly. Yes.
I really appreciate all of the insight with that. And I think another question I have to just kind of finish this off is, what are the resources that you have used to help yourself? I know we've got a lot of conferences coming up.
Yeah.
Anything you recommend for those people that are watching that are really kind of feeling that burnout weighing heavily or creeping up?
The DPC community is just so rich, and there's so many different opportunities and ways to get the help and support that you need to not feel like you have to do it on your own. And so there's the DPC summit this summer in Texas. There's the Hint Summit in September, which I'm going to be the MC at.
Yay.
There's little sections at a lot of different meetings that are devoted to. I think you're going to FMX, or maybe you're not going to
Yeah,
FMX.
and we'll also be at DPC Summit, and a few of us will be at Hint. Yeah,
Yeah. And so
we
there's
get
so many
around.
different opportunities. There's also great podcasts. Healthcare Americana, My DPC Story. Myself and a fellow pediatrician started a pediatric DPC
Oh,
podcast.
really?
I don't think I've even told
Fun.
you this.
No, I
Yeah,
didn't know. Of course, you have something new
I know. I always have too
because
many
you
new
were
things.
bored.
Yep, I was bored. So I was like, well, let's start a podcast. It's called DPC Pediatricians.
Cool. That's awesome.
DPC Pediatricians podcast. So that's another place to find good information and helpful information. There's so many different resources out there. And then the Facebook groups are a really great way for physicians to help each other to just kind of get all of those touch points and figure out the nitty gritty stuff that comes up when you're starting or growing your business. There's also books like Shane Purcell's Magic and Pixie Dust book. There's several, and Paul Thomas has a book too. There's just so many good resources out there. I think most DPC curious people will be overwhelmed with the number of resources
Yeah.
and trying to like figure out which ones are good ones, which ones are helpful ones, because there's just so much helpful information out there that can almost feel overwhelming to try and wade through all of the different information that's out there that's helpful for people that want to start their own practice.
Yeah, I can see how it's especially in the past 2 years, there's just a wealth of information.
For
One
sure.
conference I want to add on there is the Lifestyle Med Conference. If
Oh
anybody's
yeah,
lifestyle or preventative focused, we went to that last year. That was my first time attending, and I was just blown away from everybody's so friendly. Anytime you go to a DPC conference,
for
it
sure.
it's like all these people are happy with their jobs, so they're not being, grumpy and
Totally.
competitive, very
Totally.
collaborative. And while Lifestyle Med isn't necessarily DPC focused, there are a lot of DPC docs there. It
For
was a
sure.
very similar atmosphere of people just loving life and wanting to get the most out of it. So I'll
Yeah,
add that in there. And of course, freedom. We're here for you guys, whether you decide
absolutely.
to work with us and use our services or not. We're happy to help point you in the right direction. And if a resource exists, then we know about it. So
Yeah,
feel free.
I think the thing is too, like there's a value to getting help and not having to just figure it out from scratch, or just going on YouTube and like trying to figure out how to start your business and grow your business and
Really.
fill out all those sorts of things. Like there is a value to getting the help that you need so that you're not spinning your wheels and you're not adding 2 years to your startup journey because you're just in the weeds of everything. There is a lot of value to being able to quickly get going and get help and support that you need, even when it's, trading your time for for money, to get help from expert resources out there and to get people that can actually do work on your behalf for you.
Yeah, I appreciate that. Well, as always, it's been so much fun. I can't wait to listen to the podcast. Can't wait to see other
Thanks.
places. Anybody who's not following you on social is missing out. I think just another piece of that burnout prevention is just making things not perfect and just
Yeah,
jumping in. And you do such a great job of modeling that for all of us. So keep your eyes open for an email coming through with this recording so you can share it with all of your friends, especially with the holiday weekend coming up. I'm sure we'll have quite a few people watching this back. But
awesome.
hope you have a happy Memorial Day. And thank you so much for visiting with us.
Absolutely. Great to chat, Sarah. Thank you.
See you, Dr. Boucher.